Does a video promising to blow the lid off COVID-19 vaccines present only true and verified statements? No, that's not true. It makes claims about vaccine-related deaths that are not proven. The video also questions why pregnant women and people who have recovered from COVID-19 would get the vaccine, ignoring what most medical experts say about those groups. Finally, it presents the vaccine as the key component of a grand plan to control the populace. A conspiracy theory for which there is no publicly available evidence. The video was published on Rumble on May 27, 2021. Titled, Massive. World-renowned doctor blows lid off of COVID vaccine. It features clips from an interview with Dr. Peter McCullough, identified as a doctor of internal medicine and board-certified cardiologist. He says, at 1 minute, 41 seconds, quote, "There are over 4,000 dead Americans. There's over 10,000 dead people in Europe that die on days 1, 2 and 3 after the vaccine." End quote. His comments can be heard below. At the time of writing, on June 1, 2021, there have been no documented deaths due to the Pfizer, Moderna or Janssen vaccines. The Centers for Disease Control and Prevention, CDC, says on its website, quote, "A review of available clinical information, including death certificates, autopsy, and medical records has not established a causal link to COVID-19 vaccines." However, recent reports indicate a plausible causal relationship between the Janssen COVID-19 vaccine and a rare and serious adverse event, blood clots with low platelets, which has caused deaths. End quote. The CDC uses the Vaccine Adverse Event Reporting System, also known as VAERS, to follow up on any report of death after vaccination. McCullough, identified as Vice Chief of Medicine at Baylor University Medical Center in Dallas, Texas, does not specifically mention VAERS in the video, but that's likely what he is referring to when he talks about the database. At 4 minutes, 10 seconds, he says, quote, "All those thousands of Americans that have died with the vaccine, and hospitalizations in the database, I think are real, and they are far beyond anything we've ever seen." End quote. What McCullough doesn't explain is that VAERS is an unchecked list of vaccine reaction reports to which anyone can add an item. To view the VAERS site, users must click on a box agreeing that they have read the caveats about VAERS reports. The reports are not verified and are not sufficient evidence to establish whether a death was caused by a vaccine. The website for VAERS makes clear the system's uses and limitations. The site reads, quote, "A report to VAERS generally does not prove that the identified vaccines caused the adverse event described. It only confirms that the reported event occurred sometime after vaccine was given. No proof that the event was caused by the vaccine is required in order for VAERS to accept the report. VAERS accepts all reports without judging whether the event was caused by the vaccine." End quote. More than 285 million doses of COVID-19 vaccines were administered in the United States between December 14, 2020, and May 24, 2021. As Lead Stories has reported previously, it's statistically inevitable that some people will get sick and die of unrelated causes after getting the COVID-19 vaccine. At 11 minutes, 41 seconds, McCullough questions why certain groups of people would ever get the vaccine. He says, quote, "Before we know it, we're vaccinating pregnant women. Why are we doing that? That can't be safe. Now we're going to vaccinate COVID-recovered patients. Wait a minute. They have complete and robust permanent immunity." End quote. That's not what doctors with the relevant expertise say. The CDC recommends that people get vaccinated, regardless of whether they had COVID-19, because it's unclear how long such people are protected. The agency says on its site, quote, "Even if you have already recovered from COVID-19, it is possible, although rare, that you could be infected with the virus that causes COVID-19 again." End quote. The CDC also says that pregnant people can get vaccinated, although it acknowledges that there is limited safety data at this point. It notes that pregnant people are at increased risk for severe illness from COVID-19 and that pregnant women with the disease are also at increased risk of preterm birth, compared with pregnant women without COVID-19. McCullough does not mention any of that nuance in the clips. Rather, He presents the vaccine as a grand plan to create compliance and control behavior. At 5 minutes, 52 seconds, he says, quote, "This is actually about marking. The vaccine is a way of marking people. It's a way of starting to assert efforts to create compliance, behavior control." End quote.